Hi there, welcome back to my YouTube channel. Thank you so much for watching. Please remember to subscribe to the channel, click on the notifications, and also like the videos here on YouTube. Also check out the playlist so that you can find more videos on cosmetic surgery. So today I am talking to Christopher and he is a massage therapist. Hi there, thank you so much for joining me today. Please introduce yourself and just tell me a little bit about what you do.
Hello, I am Christopher Laughhunn, licensed massage therapist. I do massage. My main focus is connective tissue, lymph work, keeping people healthy. I'm primarily located in Farmington, Michigan, USA, and that's where my office is located. I do other work outside of my office, but my primary place is there. I tend not to do a lot of mobile massage.
Right. Okay, clients come to you then, yeah?
Yes.
That's brilliant. So because I'm focusing more on cosmetic surgery, what sort of procedures can you offer for people that have had cosmetic surgery?
Rehab type treatments for anytime you've had any kind of cosmetic surgery for your abdomen or any part of your body. You're going to need some lymph work to make sure that fluid keeps flowing properly and to reduce the possibility of blood clots and to make sure your scar tissue doesn't build up and you end up with puckering or any extra lumps or bumps that you weren't expecting, which is kind of the whole reason you got the surgery in the first place. Smooth everything out.
That's great. So just explain to me a little bit about the lymphatic drainage treatment. So that's sort of what a lot of people tend to want to have after the surgery. What is the benefits of that?
The benefit of that is the lack of swelling and a lack of stale lymph. Stale lymph tends to breed infection, tends to breed disease. You want to keep your fluids flowing in your body. You want to keep your tissues lubricated in your body. So the more fluids are flowing, the more tissues can get their nutrients, and you can end up with a better looking body and a healthier body.
Okay. And is there anything that someone would need to look out for them to know that they actually need this done?
If they've ever had any type of surgery, period, cosmetic or otherwise, you need to have some type of rehab treatment afterwards. Personally, I recently had my appendix removed, and months later, I'm still dealing with the therapy to break down extra scar tissue just so everything functions properly.
Okay, brilliant. So tell me, when you're having this procedure done, if you've just had surgery, say you've had surgery 2 days previously, say you've had lipo or something like that, is the treatment going to be painful at all?
It doesn't have to be, no. A good therapist will be able to treat you when your doctor says you need that treatment, as soon as the doctor says you need it, and shouldn't be painful. The lighter touch will still move that lymph and still manipulate the tissues enough to not have a buildup of scar tissue.
Right.
If you do have any type of deeper myofascial treatment, now you're dealing with deeper tissues in the body. That's going to be a bit painful, but that should not be soon after surgery at all.
Yeah, I have seen like a few videos and people do look like they're in like a little bit of pain, or quite a lot of pain actually, when they're having some of these procedures done. So I was just wondering. Tell me as well, what sort of things would you advise someone that they might need to do to prepare for the treatment, either before or after? Is there anything they can do to prepare their bodies for the treatment?
Honestly, drink plenty of fluids, a lot of water, mainly water. I wouldn't drink any alcohol for a while after your surgery, and make sure you have loose fitting clothing, because when people get on the table, they feel they want to feel comfortable, and they'll have certain restrictive clothing. Even their underwear will be restrictive to the point where that can slow down or restrict the flow of lymph. You're better off wearing nothing when you're on the table, but even though you're on the table wearing nothing, you're still going to be covered up.
That's what I was going to ask you. Like, what would someone be wearing when they're having the treatment done?
Honestly, the best thing is nothing.
Okay.
That way your lymph, like I said, flows freely. There have been a few studies even considering the effects of bras on women, and it slows down and stops the flow of lymph and can be a huge contributing factor to breast cancer.
Oh, okay. So tell me, how many sessions would somebody need to have, and when would they start to see the results?
When it comes to lymph, you see the results immediately that day.
Okay.
I used to tell my students, because I used to teach massage, you could advertise a lymph massage by saying lose up to 5 pounds in 1 hour. I've seen it happen. It's literally just 5 pounds of lymph. It's water weight.
Okay.
When it comes to how many sessions you need after your surgery, you need as many as honestly you need. It depends on the person. It depends on how seriously you take your recovery. Some people will do different exercises, different things that are prescribed by their doctor, not just massage, and their recovery will be fairly short. Others won't do a lot of things on their own, and their recovery tends to be a bit longer. So a lot of that depends on you.
Okay. So tell me as well, when it comes to like the timing of to have the massages done, does it always need to be just immediately after surgery? Is it beneficial, say 6 months, if you didn't do it in the beginning, or is it just too late then?
It's never too late. The sooner the better. As soon as your doctor says you can get it, you should get it. The longer you wait, the more lymph you have that will sit in the wrong place, the higher chances of blood clots, higher chances of negative scar tissue building up in places where you don't want it.
Right. Okay. And is there any situations where somebody wouldn't be able to have the massages done? Say if they have like an open wound or something like that, would you just say to them, it's not possible now, or does it not matter?
When it comes to my scope of practice, if there's an open wound, we're supposed to leave it alone.
Yeah.
But
okay.
In a post-op situation dealing with other types of therapists, they have worked on people with that open wound just to try to drain everything properly. So proper training will be able to help you even if you have an open wound in a certain spot. Therapists are trained to spot open wounds and either avoid them when we're supposed to, and definitely inform our client as to what's going on and what we found. So
that's great.
follow your doctor's orders is my best advice.
That's great. So what would it be like for your practice? Do you have any packages that you advise the customers of, or any discounts or anything like that?
Honestly, the more you get, the more you save.
Okay.
What I have put together on my site is a short series of massages in a package, and there's a subscription you can actually get where you get, I think, like 1 or 2 a month, and you save $20 or $30. If you get a big package, say you buy 5 all at once, it's like paying for 4 and getting 1 free.
That's brilliant. That's brilliant, Christopher. Just the last question for you. Just tell me how someone would be able to contact you. What's the best means of contact? I'll put the details below, but would it be the telephone or website, a booking or something like that?
Honestly, if you go to my website, it has everything you need, including telephone numbers. So that would be deeptissuetherapeutic.abmp.com, and you will find my address, phone number, email, ways to contact me, all on the website.
That's brilliant. That's great. Thank you. Bye.
Great. See you later. Bye.
Bye.